Yeah. Hello, everyone. Thank you for joining the webinar today. And today we have Dr. Athresh here. So he'll be speaking about, his life in the UK. He recently cleared PLAB Part 1 and Part 2 and moved to the UK a couple of months ago. So we've got Dr. Athresh on board to speak about his recent experience going through the PLAB pathway. And if you guys have any doubts or something, he can get it clarified and, make your journey much more better. That's what I feel. So, hello, Dr. Athresh. How are you?
Hello. Good morning, everyone. I'm Dr. Athresh KN. I'm presently working in Skantop General Hospital as a CT level doctor in Trauma and Orthopaedics surgery. This is my third month working in the NHS. Can I just share the screen?
Sure.
All right. Is it audible?
Yes, it is clear.
Is it audible now?
The participants, you can just leave a message on the chat box if Dr. Athresh's screen is visible and if he's audible.
Yes. Starting with my studies, I finished my MBBS in JJ Medical College, Davangere. I passed in March 2019. And then I started working as a junior resident in trauma accident and emergency in Vasavi Hospital, Bangalore. I worked for around 2 years there while I was preparing for my PLAB journey. I started my preparation for my PLAB journey, I think from April 2019. And then I cleared my OET in November 2019. But like many other doctors, I didn't clear my OET in the first attempt. And it's very normal and very natural for most of you to miss the grades in the first attempt. And it's okay. Don't give up at this stage. And secondly, the biggest hurdle was getting a slot for PLAB 1. I gave my PLAB 1 in November 2020, but my PLAB 1 was first booked for March 2020. I'm from India, from south part of India, but although all the slots were full, so I had to book my PLAB 1 in Bangladesh. And then I had to cancel it and again shifted my PLAB for the next June in Mumbai. And then due to COVID, the PLAB 1 was cancelled everywhere in the world. And then after waiting for a long time, I got a chance to clear my PLAB 1 give my PLAB 1 in November, and I passed in the first attempt. Is it audible, Chandan?
Yes, doctor, it's clearly audible.
Yes, I cleared my PLAB in my first attempt. For the PLAB 1 preparation, I think PLABable and PLAB 1 keys are more than enough. They're the best material available. There are a lot of MCQ questions. And then PLAB 1 keys gives you a kind of notes which you can go through every day very easily and very quickly. So for PLAB 1, revision is the most important thing. So the more number of times you revise the topics, you're going to do well in the exam. Do not revise the questions, just revise the topics and the concept. So you're going to be very quick in answering in the exam. And then after PLAB 1, again, I was stuck with all the hurdle in booking PLAB 2. I tried twice, but I could not get slots for PLAB 2 because there are more number of people and less number of seats. And then India was put in the red list. So there was travel ban and I could not apply for a visa. Luckily, I had my PLAB 2 in October 27th, just after the red list. So I had to rush into UK and I had 4 to 5 weeks of time in the UK for preparing for my PLAB 2. And then I cleared it in the first attempt. And everybody's affected by COVID. There's delays with everyone. So do not worry if you are stuck in this COVID in some part of the PLAB journey because of COVID. It's quite natural. And second thing, PLAB journey is not easy, but it's very much doable, provided you put your efforts and you're dedicated well. And so a lot of people ask me regarding how to get a first job. Is it tough to get a first job? What do you need in specifications in your CV that they're looking for your first job? First simple things which you can do when you're in med school or you're working back home in your country is do an audit. In UK, they value a lot for clinical audits and quality improvement projects. There's no point in you doing audits which would take one cycle of the audit to take 6 months or 8 months. Just do a simple audit like VT prophylaxis or any documentation audit, like you go through the notes in your hospital and see if the KMC number or the registration number is not filled in every page according to the guidelines. And it would take only 1 week to finish one cycle of such small audits. Your audit must be quick enough, and you make sure you need to finish 3 cycles of the audit. Then only audit has good value. And you put a big, nice impression on the interview's face when you say you have done a clinical audit and you are well experienced with it. Other things is you can take part in research. I know as med students, we do not get much opportunity to take part as research. You need to go to your postgraduates and talk to them. They're always involved in the research, as it's very much compulsory for them. And you can join them, help them, and be a co-author of research and publication. And it's always better if you have a publication in PubMed cited journals. You can just go through the website to know the list of journals which are PubMed cited. And then once you come to the UK for your PLAB 2, I would say, well in advance, you need to book for ALS course, Adult Life Support by Resuscitation Council of UK. This is very much important. First thing is important because you learn a lot, and it's very important for you to identify when to escalate the patient, when to start CPR, when to call the critical outreach. And ALS course is a very good course. And second thing, it's very important for your portfolio and the job. Back when I was applying for the jobs, ALS course was in the desirable criteria, but now ALS course is considered as essential criteria in most of the jobs. So I think you need to plan it well ahead. When you come for your PLAB, you need to book your ALS course in UK. Although it's expensive, it's very much important for your career and also to, for gaining good amount of knowledge and skills. Work experience, if you have work experience, it's well and good. Even if you do not have work experience, do not bother. Internship is enough for to getting your first job. There are some cases where people have do not get a job in FY2 position because they have experience of 3 to 4 years. In that case, you get a job in CT level position and you'll have adequate shadowing period. So do not worry about it. You can easily get into the system and learn things and start working in the NHS. And the trend is going back again to clinical attachment. Try to get a clinical attachment in an hospital setting. Try to build your contacts through LinkedIn, through colleague friends. Apply, send your CVs to the hospital website and try to get a clinical attachment. Usually, most of the time, people are offered jobs directly in the same hospital where they do the observationship. And these are few simple things which can be done easily by anyone and bring nice points into your portfolio. So if you have all of this and there's another candidate who does not have any of this, you will be selected straight away because you are interested in research, you have done audit, you have good experience with audit, and most importantly, you have other ALS certification. That means you can be trusted because you know early diagnosis, you know how to manage things in the UK. And if you have done a clinical attachment, you know how the hospital works, how the NHS works. So easy for them to get you into the hospital straight away. And you are already oriented to the NHS. So it will be easy for you to work as well. And the next thing is job application. A lot of my friends and juniors ask me, how many applications did you use? Which website do you prefer? How many did you fill in? It was during the Christmas time I was filling in applications. So there was not much interviews happening and there was a lot of delay. And it was the COVID Omicron wave at that time. So I filled over 100 applications after my GMC registration. I got shortlisted for 3 interviews and I got 2 job offers. All the interviews are online, so it does not matter you are in UK or you are in India. Just make sure you let them know where you are. And even if you are in UK, you need to go back to India to get your work visa converted. Previously, there was a provision to convert in UK, but now everyone has to go back to their home countries to get their work visa. So it does not matter if you are in India or in UK, as long as you fit in the criteria. And I would suggest you need to apply for all the NHS jobs, irrespective of the hospital, irrespective of the trust, irrespective of the department. Once you get into the NHS, you get 6 months of experience. Then you can easily move to other jobs. You can take internal transfers in the same hospital, or you can move to other trusts. They would prefer someone with NHS experience easily. So do not worry about what post or what job or what hospital you're getting into. As long as you're in the NHS, the training is same, the salary is same, the guidance you get is same. They have a very good system here, so everything is same. So try to get into any job, it doesn't matter. And when it comes to the job interview, it usually lasts for 10 to 15 minutes. They ask one medical scenario. The medical scenario is not very tough because they're judging you if you're competent enough to work as a junior doctor at the FY2 level. So you'll have a basic medical scenario or something like how would you approach a patient who is in suspected stroke, or how would you approach to a deteriorating patient, or uh, how would you approach to a patient who complains with chest pain. They're checking if your basics are good, you know how to diagnose if the patient is deteriorating, you involve your seniors, you just have to make sure you're safe, give the basic treatment, and make sure the patient is not dying, and then involve your seniors for further advice without any hesitation, because at the end, patient care is the most priority. Second thing, you get some ethical scenarios. It could be like, what do you if one of your colleagues is very late to the work continuously, how would you approach to him? If you can smell alcohol from one of your colleague, what would you do next? If you feel some colleague is not working right, he's not doing right justice to the patient, how would you approach to them? They would ask about clinical governance, pillars of clinical governance, and other basic healthcare questions. You can read some of the blogs online, you can watch some YouTube videos. And I think I have gone through some of the videos of Dr. Raja Adnan, if I'm not wrong. He's a psychiatrist. He has done amazing YouTube videos on these basic questions asked during the interviews. There are like 10 to 15 questions, and usually you will get one of these questions only. So it's quite doable. And then they ask you some personal questions like, uh, why do you want this job? Why do you think you fit into this position? What are your future career goals? Where do you see yourselves after 5 years? Interviews are quite simple. You just have to show you're competent enough, you're as a junior doctor, and you know your basics good. So they're not judging your knowledge to be that of a consultant. As long as your basics are good, you'll go past the interview easily. Once you get your interview done, you're selected. Here comes the tier 2 visa. Unlike your PLAB visa, you need not worry for tier 2 visa. You just need 3 to 4 documents. First thing is the certificate of sponsorship. It will be offered, given by the HR. You just have to make sure, tell the HR that, remind them to tick in the maintenance category. So you don't need to show your bank statements for tier 2 visa, as the maintenance is taken care by the hospital in the initial months. Next, you need a police clearance. If you're from India, you need a police clearance from Passport Saver and or All India Police Clearance. A couple of months ago, they used to accept state police clearance, but now, for some reason, they're not accepting, and they're not rejecting the visa, but they're asking the applicants to provide the police clearance within 28 days. And at last moment, getting the police clearance, there might be chance of delay because you might not get appointment in the Passport Seva, or you need to travel to other city to get the police clearance. So it's better you have the police clearance well in advance, as it's valid for 6 months. Once you get their job, even before waiting for your COS, you can apply for the police clearance, and things will be very smoother. And they will need a TB clearance. You can look at the UK government website to know to check into the nearest center where you can get a TB clearance certificate, and this is also valid for 6 months. And these days, sometimes for some people, the visa to get a Tier 2 visa, they are requesting for proof of hospital address, proof of stay where you'll be staying in the initial months. You can request your HR, and almost all the HRs would give a letter stating that you will be staying with the hospital in the hospital accommodation for the initial months, and it is straight away accepted by the visa. Otherwise, also it's okay. You can book temporarily on Booking.com or any other website. You need to show them that you have some place of accommodation, and you're not a burden to the country. You have some kind of accommodation, so it's very safe for them to issue a visa to you. Standard, usually the NHS healthcare visa comes under shortage occupation list. So it's usually issued within 2 weeks of completing the application and submitting the biometrics. However, now there is a delay because of the war crisis and other crises, and everybody knows about the delay. So even your HR understands if there is any delay in issuing of visa or delay in your relocation, and they help with you. They help you with this. So do not panic if you have any delays. Once you get your email, make sure you let your HR know that you have got your visa. Oh, and then tell your HR that this is your tentative date of travel, so they can book in an occupational health appointment. Usually it would take, you cannot get occupational health appointment immediately. So if they plan well in advance and take an appointment, from the time, it would take at least 1 week for you to come to UK after your visa. And after 1 week, you usually get your BRP and your occupational health hazard. So there's not much waiting for you in the UK. You can come and start working in 2 to 3 weeks. And then most of the IMGs ask me the question, what is the pay scale? How much are you paid? Is it enough? Is it sufficient? I would say throughout the UK, you get a standard pay, whether it is F2 or CT or ST. There's a standard base pay for F2, there's standard base pay for core training, and there's something called as enhancement. If you have duties after 5 o'clock, if you work on the weekends, if you work on the nights, you have around 20 to 37% of enhancement for those many hours. You are paid well enough to take care of yourself and your family, maintain a house, and have a car. And also, you can do some locum shifts like internal locum or external locums, where you're paid like 40 to 50 pounds an hour. During your free days, you can get extra earning, and this can still add to your savings. But maybe after 1 or 2 months, once you start working in the NHS, you would soon realize you need more personal time and family time, not just a work time. You need good work-life balance. So you would not end up doing locums every weekend, but you can still do locums once in a while, so that you get a little extra saving, and then you can manage well. And talking about work life, the staff, right from the staff, from the support nursing group, from the administration, everybody is very supportive. They know you are an IMG, you are new to the system, you need time to adapt into the system. They're very helpful, and the consultants are very friendly. Everybody work looks after you very well. You don't feel like you're in a new country where you're working with new people. And good thing about working in the NHS is, although you're a junior doctor, you take your own decisions regarding the treatment of the patient. So you're more responsible, and you're working like an actual doctor, which does not happen back home in some countries. You're working as an actual doctor. So just make sure whatever you work, you're getting right advice from your seniors. Ask for help whenever you need, and document everything, whatever you do. Even if you have taken an on-call advice through phone with your senior, just document, take an advice from so and so on phone at so and so time. This is to make sure that you are covered well by the seniors, and also giving the right treatment to the patients. If you have not documented something, it means you are not treated for that thing. So make sure whatever you do, you are documenting it. So I think these are all these general questions which everybody have doubts. You can ask some questions if you have any more doubts, or if you have any questions to ask, I'm more than happy to answer to you.
Dr. Athresh, I can just ask you a general question, which I'm being asked a lot.
Yes.
How long does it take for you to, get your GMC registration and then get placed in your job?
I would say for GMC registration, you need to submit as minimum documents. I mean, if they have, generally it's 5 to 6 documents, you need to submit the exact number of documents. If your timeline, if there are no confusion in your application, like you start to work after your registration with your in your council, medical council, in whichever state or whichever country you are, and you have your timeline, like the job experience, everything done correctly. Like some people start working even before getting a registration with the state council. So all these cause the delay. If you have all the documents right, you would get your GMC registration within 5 weeks, 5 days.
Great. Right now I think there's a bit of delay going on. It's taken about 15 to 20 working days, but usually, that is how it's supposed to be, right? Within.
Usually it happens within 1 week, and the delays happen even if they have a slight confusion. They'll ask you a query, and when you reply to the query, they generally open your application only weekly once. So if there's a query sent to you on Wednesday, you replied back on Thursday. So they're going to check it only on next Wednesday. So that's why there is a delay happening. So
Okay.
make sure you submit everything straight away initially. So it'll be very quick.
And doctor, once you get placed in your job, as an SHO, what are they expecting from you? Like, what are your typical daily duties you'll have to do?
So if you're once you start your job as an SHO, there's something called ward cover and on-call cover, irrespective of the department. When you're in the ward cover, you do the daily rounds with the consultant or the registrar, and then you make a plan for every patient, and then you start working on the plan. If there are any bloods and cannula, one thing I need to say, bloods and cannula are usually done by the junior doctors, not by the nurses. So you make sure you do the bloods and cannulas for your patients, and you follow up with the blood reports. There's nobody coming and telling you the blood reports are out, you need to check this, you need to make plans, you need to show your own interest. You need to remember that you need to follow up whatever the plan you are is. And once the blood reports come, you need to follow up with the plan. You need to keep the registrar or consultant involved, and you need to take care of the patients on your own. In the sense, you can ask for help anytime, but you are more responsible. You need to take decisions your own. Sometimes you need to be smart, but it's quite doable if your basics are strong, if you're paying good attention during the rounds. If you have any doubts regarding any management, you can straight away ask to the consultant, and they're very helpful. So you are taking part in management of any patient, and you're working along with them. You're not working under any consultant, you're working along with the consultant as a team. So you are equally respected and treated well by the consultants. So this is the ward cover. When it comes to on call, you need to take any new references from other departments or any new references from A&E, and you need to review the patient, and then discuss with, if you can make decisions, you can make decisions and treat the patient. If you have any doubts, you can talk to your senior registrar or consultant and make clinical decisions and make the treatment. Usually the duty hours in any medical departments is 9 to 5. If it is a surgical, all surgical jobs start at 8 o'clock and finish at 5 o'clock. If you're on call, there's something called long days in the NHS. If you're on call, your day on call will be from 8 o'clock to 8 o'clock in the night. If it is a night duty, it's 8 to next day morning in the night.
Great.
And
Yeah.
it depends on your contract. Sometimes you get on calls and weekends once in every 3 weeks. Sometimes you get once in every 8 weeks. So your pay scale, the enhancement is going to depend on what's your rota pattern like. Is it 1 in 3 weekend, or 1 in 8 weekend, or 1 in 5 weekend?
Yeah. I think there are a couple of questions in the question and answer box. You can just
Yes.
answer one by one, if that's all right.
Yes. So one of the doctors are asking, is rural service of 1 year also taken into consideration? Well, yes. Even during rural service, you're working as a doctor. Make sure you get all your certificates, your work experience letter in a bona fide letter, any references from other consultants, everything ready before you come to the UK, before you make your GMC application. So there won't be any confusion, or the GMC would not consider this as any fraud or fake certificates. Second, another doctor is asking, will the presence of a clinical gap of 1 year after internship affect the chances of getting a job in the NHS? I would say no clinical job would affect your getting a chance of job in the NHS. However, if you have a lot of experience in surgical departments, if you have more than 18 months of experience in surgical department, it's very hard for you to get into co-surgical training. So I would say, please don't work for more than 18 months in surgical departments if you are aiming for co-surgical training. What are some courses we can take in India which would help boost our portfolio? You can attend medical conferences. You can do some poster presentation, whether it's regional or national or international. Everything is helpful. Everything runs on point-based system. So if you have more points, you are selected well in that application and you are shortlisted for the interview. That's how you get into the training. How to apply for ALS course? I would say you look into Research Council UK website, and usually most of the times it's full. So what you need to do, you need to select the cities you are comfortable where you need to do the ALS course. There's a contact phone number and contact email left with. You need to email them personally, stating you are sending your details and you are looking for ALS course. And as soon as there's a vacancy, they'll reply you back and you can book it directly. Is the job availability still good? How long does it take to find the job after GMC registration? Any place in the UK is fine. Job availability generally depends on what time of the year you are attending, you are applying. Usually during the August, it's tough because most of the people are recruited in June or July because that's when all the training shifts. But I would say there's shortage of doctors, so you would definitely get a job. All it matters is how you present your CV and how you present your application, and try to get into the clinical attachment so you're offered job directly. You can still get jobs. Sometimes people get job in 1 month, sometimes people get job in 6 to 8 months, but at the end of it does not matter if it takes 3 months or 6 months. When you consider long-term career, everything is fine. What is the main factor that help you to get this job? I would say I had done audits. I've done ALS course. I had job experience in a trauma center, and had a publication in as a co-author in PubMed. And I was interested in research and other teaching elements. Is there any required score in OET to get FY2 training job, like marks above 400 in all listening, reading, writing? Yes. If you want to get into standalone FY2, there is a requirement of scoring A in OET and I think 8 in IELTS in all the modules. If you are, but usually it's very hard to get into a standalone FY2. But if you are getting into a standalone FY2, if you fit in the criteria, I would say just go for it, because standalone FY2 comes under Health Education England. So you're rotated well, you're taken care well by the Health Education England, and it's a protected job because this is your first job in UK. If you're not able to get the FY2 standalone program, it's still fine. You can get into non-training FY2. 90% of the IMGs get into non-training jobs initially because it's competitive to get into training jobs. You can, I think you need to get into standalone FY2 jobs in through Oriel website. Just go through it, not through the NHS track jobs or anything. You need to go through Oriel website. Is there a validity for ALS certificate estimated cost? The ALS course by Research Council of UK is usually valid for 4 years, and there are two kinds of ALS conducted. One is EALS, other one is face-to-face ALS. Both are same and both have same points, both CPD points. In EALS, you do 1 day of online session and 1 day face-to-face session where you are assessed and there is a theory test. In 2 day face-to-face ALS, both the days it's a face-to-face program, so you get to learn more. You get more hands-on with something like, for example, intraosseous cannulation, how to hold the drill, everything which in not many countries doctors are trained to. And estimated cost, it depends. Generally, the ELS is usually cheaper. It costs around 300 to 350 pounds. And the face-to-face ALS costs around 500 to 670 pounds. It depends on the location. But any ALS, whether it is EALS or ALS, it doesn't matter. Just take it. And it's valid for 4 years. Just a moment, please. All right. Could you please tell me if a clinical gap of 2 years will be an issue to get a job? Clinical gap of 2 years will not be an issue to get a job, provided you frankly tell why was a 2 years gap or job gap. Is it like you were preparing for another exam, or you were doing another job back home, or you were involved in some other academics like doing an MBA or doing any masters? So you need to be honest and truthful, then it does not matter. How long does it take to get a non-training job, and how long approximately do we have to do it? It depends from person to person, but it takes a minimum of at least 1 to 2 months for you to get shortlisted for interviews for non-training jobs. And you can do a non-training job as long as you wish until you get into the training. Getting into the training is not as easy as we think, because you need to build your CV very well. You can go through getting into IMT or getting into core surgical training on UK websites. There is a list of points. It's like you do a 3 cycle audit, you get 8 points. You do a PubMed cited publication, you get 6 points. You do involve in a leadership program, you get 5 points. So I have seen some of the mistakes what people do. They do around 7 to 8 3 cycle audits, and they do not show any interest towards research. I would say that is totally waste, because you do one 3 cycle audit, you get the maximum points in that category. So there's no additional use of doing more audits. You can put your efforts and show your interest in research, so you get points in both the categories. At the end, it's not the number of things you have on your paper, it's the number of points you fit in each category, and which is added together, that is more important. So you need to plan accordingly and start having points in all the categories, so it would boost your CV very well. Where can I find point system for ACCS emergency med program? So ACCS program, right now it's under IMT training, and some slots are also there under MSRA, but mostly you are under the IMT training. So you can look into IMT application scoring, and you'll get to know about the point system for ACCS emergency med program. It's one of the training programs which is in high demand and very competitive. For clinical attachment, do we look at NHS trust websites, or should we individually go to the hospital website, because it's hard getting consultant's name from the hospital website? You can look into the hospital websites and get any email of any HR or medical staffing, and you can email them directly. Or if you know any consultants personally, you can email them, or you can get connected to consultants on LinkedIn, and you can message them. And most of the consultants are very happy to help you. How long does it take to prepare for PLAB 1 after internship? Is the coaching for Indian medical entrance exam sufficient for PLAB? It generally differs from person to person how long it takes for PLAB 1 preparation. But I would say you need to keep at least 2 to 3 months reserved for PLAB 1 preparation. And it's totally different from Indian medical entrance, because PLAB is more of clinical, less of theory. In Indian medical entrance, you learn anatomy, you learn biochemistry, but for PLAB, you need to learn applied anatomy, applied biochemistry. So it's more of clinical and less of theoretical. If we have a ACLS certificate which is valid, do we need to take it from UK? If you have a ACLS certificate, it's I think it's from American Art Association. It's still valid. And it's still a good thing for your first job. But then once you get into the job, you need to do a UK Research Council. It's not recognized by the UK NHS. So they still consider it as equivalent for your first job. So it's totally fine. Do not worry about it. Finished internship in May. I'm currently preparing for PLAB 2. And if I get a job only by next August, will it be an issue in the interview? Any suggestions? What can I do during this time? So if you're still I did not understand this. I'm currently preparing for PLAB 2. If I get a job only by next August, will this be an issue? No, it will not be an issue, because even all the consultants, interview panels, everybody know there's a long queue for PLAB 1 and PLAB 2 these days. It takes 2 years for you to finish the journey, and they're well aware of it. Just make sure you tell you're studying or working or what you did during this period, so to fill in the gap. And you need to be truthful and honest, and they're going to agree with it. It's not going to cause any issue. Is the ELS course to be done in UK? Yes, even if it is ELS is one day you do it in your house and they online. And for the day 2, you need to be physically present for them to assess you and then give you the certification. Can we do audits in UK during our non-training jobs? Yes, you can do audits in UK during your non-training jobs, and everybody is very happy to help you for doing audit. They very well appreciate you for showing interest towards audits and research. Is it possible to get a non-training job without audits and research? It is still possible to get a non-training job without audits and research, but it's going to take a long time. If I would be an exam interviewer, if there are two candidates, one has audits and research and the other candidate do not, and rest everything is same, I would definitely prefer the doctor who has audits and research. So that's why it's important. Research is fine, but audit is easily doable when you're in med school. So I would say do an audit back home, and you have a clear picture about audit, so you can present well in the interview. Does NHS cover ALS expense during a non-training job? Yes, any job you take in the UK, you need to talk to your trust. You will have something called study budget. Sometimes the study budget is only £500. Sometimes it is £1,000. Sometimes it is £2,000. Based on how much study budget you have, you can claim the expenses. But you cannot claim the expense for ALS course which you have done before getting into the trust. But you can claim the expense for ALS course after you get into the trust. Could you please repeat the website you mentioned for scoring point criteria for CV? I think you need to Google how to maximize points in IMT application. It would take you to MediBuddy. It's one of the website which will guide you, help you to expand your point, maximize your points. If you want the official details, you need to Google IMT NHS or IMT Health Education England, wherein you will get all the details of the point list. If you are going for core surgical training, you need to Google, I think, points for core surgical training, and you'll get a complete list, and it's very clear in the application, so you'll get a better picture. Just a moment. Audits can be done during my clinical attachment. Will they help or allow us to do? I've heard that you can do an audit during your clinical attachment, but personally, I have not seen anyone who has done an audit during clinical attachment, because your clinical attachment will be for very short duration. And also, you do not, once you do an audit, you need to present with the consultants and in the department meetings. So as a clinical observationship, you might not get those opportunities. So I would say better you do audits back home, or if you're working in the UK. If you're not done it, do not worry, you can still get a job. If you're not in med school, how can we do an audit? If you're not in a med school, you can do an audit in your hospital where you're working to. Usually most of the NABH hospitals do conduct audits, and you can take part in them. You can do audits in any private hospital or any government hospital where you're working. All right, any more questions?
That will be all the questions, I guess, if in case there's, I think there'll be no more questions here. And to all of you who've been attending this session, I request all of you to register on the Inspire IMG. That's a new platform we've come up with, where, we have sessions like these quite often, where you can get all your doubts and, answered. So what I'll do is I'll send a link on your chat. So maybe after the session, you guys can register, okay? I think that was a very informative session by you, Dr. Athresh. Thank you so much for being here today.
Thank you. I'm hoping to see all the audience soon in UK and getting into NHS. And you can DM me on Instagram if you have any doubts. I'm happy to help, because I too had help from other colleagues, other people, doctors who are already in the NHS. And it's usually the way we help someone and somebody helps us. We need to be together. I'm happy to help if any candidate has any other doubts.
That's really nice of you. Yeah. Thank you so much for the session today. And thank you all for joining in. Yeah. Bye then.
Thank you.